Hi, Mrs. Smith. It's really great to see you again. As a reminder, my name is Dr. Brian Rice. I'm the treating provider here. Today, we're going to do a couple things. I'd like to review your x-rays with you. We're also going to walk through the treatment plan that I've outlined for you in order to maximize your body's ability to heal, alleviate the pressure, alleviate the strain that's being put on your body and your tissues, and hopefully we get you into a state that is less actively in pain and functioning at a higher level. I'm glad that we started off with the video. I think the video is a really, really great way for us to communicate with precision, some of the injuries that you might have sustained from the collision. That video, I think, pertains to you in a really great way in that it discusses the most common areas of injury, especially in the collision that you experience. When you're rear-ended, there's a huge amount of trauma, a huge amount of force that can go into your body and your spine. So starting with that video, while I know it can be a little bit corny, I found it's the most effective way to communicate that information, the most effective way to get that information to you. So thank you for sitting through that. I appreciate it. Now, I'd like to talk to you about your x-rays. When we're looking at your x-ray images, we're seeing a few things that are concerning to me. I know that you have pain in your lower back. I know that you have pain in your neck. And while pain is a sure sign of injury, my job is to try to identify the severity of that injury. And based off these x-ray findings, it's pretty significant. In your lower back, we're seeing compression of the discs at the fourth and the fifth lumbar. That's right through here. We're losing the curvature within the lumbar spine. And that's leading to compromise of the spinal canal and of the spinal nerves. When we have compromise within the lower back, it sets off a chain reaction that can affect everything above it and below it. The lower back is really like the stability of the spine. And if the foundation is off, just like in your house, that's going to lead to unleveling, and it's going to affect not only the first story, but the second story. And so for us, the goal is to try to decompress, try to create space, take pressure off of those nerves, take pressure off those spinal cord structures, and alleviate any sort of musculoskeletal strain that could be causing your pain complaints. And so this is going to be something that takes time. The way the human body is designed as a self-healing machine, unfortunately, it doesn't just happen overnight like that. I wish it did, but we've got a window of opportunity to try to heal and correct you. Your body is a beautiful, wonderful, smart thing, but unfortunately it's really limited. It can't think for itself and think for the future. And so a lot of times when we go into these healing processes, if they're left unchecked, left on their own, when the body needs to try to realign itself in this direction, sometimes it can miss, sometimes it can make errors, and instead of forming a smooth, replicated of the previous material that it can form these scar tissue bundles that can really be restrictive, it can cause adhesions, and it can minimize the amount of healing that is done. And that's something that is concerning to me because you have possibility for that happening if this goes unchecked. The bigger issue that I'm seeing, unfortunately, is in your neck. In your neck, we've got some obvious signs of whiplash injury. We've got some instability. I've submitted your neck study, your x-ray study for an additional digitization study to try to determine if you have permanent injury of the ligaments caused by this whiplash mechanism. When we have instability within the cervical spine, it can lead to, again, compression of the nervous system tissues. It can lead to compression of the disc material, and that causes a huge amount of strain and pressure, which, the least bit of worry is pain. The biggest issue is functional loss. It can lead to possible neurological deficit, and these are things that are really concerning to me, considering you're 33 years old, right? I'm expecting, I don't think it's outside of the realm of possibility to expect you've got 60 good years of life left, hopefully more. And so the last thing I want to do is for you to live those 60 years of life in pain and agony and wondering, hey, when's this going to end? And that's my concern for you. And I think that you and I, our goals align. I want you well, period. I want you well. But again, this is something that's going to take time. It's going to take time, energy, and commitment. And those things aren't easy. But at the same time, they're necessary. When we look at your injuries, based off my clinical experience, my history as a clinician, I expect to see progress immediately. But I don't expect to see completion or return to your pre-accident status, meaning how you felt before you're in a collision, until about 60 to 120 days. That's a period of time that I want you to start thinking, and relatively speaking, in reality, this is going to take 60 to 120 days to get us to the point where we're at the pre-accident status. The reason it takes this time is that we've got to make sure that the tissues are healing appropriately. They go through the remodeling period, the replication period, and finally their wound repair and ready for use period. And all of that takes a period of time that I want you to expect is 60 to 120 days. Now, when you're in the middle of the 60 to 120 days, it's going to feel like a lot. There's a lot that I'm asking of you: commitment, time, energy, and these things are not easily returned. But in the grand scheme of your life, 60 to 120 days is relatively quick. And so if we can work through this together, which I'll be with you the whole step of the way, if we can work through this together, I know that we're going to see excellence. We're going to see a return to your health, and I'm excited for those changes. Okay. So the next thing I want to do, I'm going to have our practice manager come in. He's going to walk you through office policies and procedures. You're going to get with me in about 10 to 15 minutes where I'm going to deliver an adjustment. If you haven't been adjusted before, it's okay. I actually prefer that. I can walk you through all the steps, everything that we do here to make sure that you have the maximum amount of comfort while we work with you to attain your health potentials and maximize those health potentials. So if you'll give me about 10, 15 minutes, I'll see you again, but let me go let Chris know that you're ready. Great.